welcome. My name is Jody Scholes. I'm your instructor for the MBLEx review course. Welcome, welcome. I am so glad that you are taking time out of your day to study. It's hard to find the time to study. Well, you're not going to find the time. You're going to make the time. And so thank you for making the time today. Today, we're actually dissecting questions for the entire class. That is going to be our learning style for today. And you may see a new face on the screen. I want to welcome the original gangster, the OG of massage therapy, and that is Ms. Ruth Werner. And Ruth is a textbook author. You may have seen her book in your classroom. You may still have it on your shelf. Ruth wrote The Massage Therapist's Guide to Pathology, and she's working on the eighth edition right now. She has been for over 3 decades a licensed massage therapist. She has been a lecturer on every stage for the AMTA, the ABMP, the Florida, for everybody. She has pretty much lectured. Now, I will also put a little pin in for the future. When you guys pass the MBLEx, Ruth has online education. She has continuing ed on pathology. She's currently in a series called Practical Pathology, uh, Real Questions, Real Answers. And it's about conditions you will see very regularly in your treatment room. Conditions like multiple sclerosis, that's
That's every
happening
day.
this today and this month. Next month, Parkinson's disease. It is so like these are things that you, as a massage therapist, are going to work with your clients for maybe 10 years, 15 years. I've been practicing 30 years. This means that you become a trusted partner with your client if they get a diagnosis like this. If they get diagnosed with MS, Parkinson's, this is so you want to go to Ruth's website and go and take her continuing ed on these different conditions. Diabetes is another one to address the GLP meds. So, really, for pathologies, Ruth Werner is your one-stop shop to learn what you need to know to be successful with your client, effective with your client treating these pathologies. So, Ruth, welcome.
Thank you so much, Jody. I'm very, very happy to be here. We play to our strengths. I work to make your job safer and more effective. And then you go out and do the work that we're all here to do to make the world a better place. So that's my role in this. You've chosen to do a thing because you feel it's important. So let's do the thing that's important. For
Yeah.
me, it turned out to be supporting you rather than doing that work myself.
Yeah, understandable, understandable. And something that this community has realized is that that massage therapy is not just a job, that it's really a calling. And so when we're in that heart space, we are happy, prosperous, and I think you said it best. Do what makes you happy. Do what you know you're here to do
Yeah.
and what you love to do.
And what a gift that is, right? How many people do we
Mhm.
know never quite figure that out?
Hmm.
I
I
feel
agree.
so, so lucky, so blessed to
Mm.
know what I'm supposed to be doing.
Oh, yes. And for our massage school graduates, it is really worth sitting for 5 minutes in the quiet and making a note of what you love. In fact, I just did this a couple days ago because we all get busy, right? We all fill our calendar. Or if we're not filling it, someone else usually is. And so to pause and make sure that there's plenty of things that you're doing that bring you joy. Yeah. Yeah. So we're going to let Ruth be in her
Excuse me.
joy here momentarily, but I want to share with our massage school graduates uh, that a quote, we are what we repeatedly do. Excellence, then, is not an act, but a habit. And this is often attributed to Aristotle, but it's also been attributed to Will Durant, so I want to give him credit too. This is kind of a start, stop, or continue moment. And so, as you're preparing for the MBLEx, as you're making time to study, this is a new routine. This is a new habit. This is this is something that you are repeatedly doing. In fact, so many people after they pass the MBLEx tell me, I woke up in the morning and I'm like, I have to study. It's like, oh, wait a minute, I don't have to study. And so this studying becomes a habit and you become excellent at it. And I want to just recognize you for the ability to begin a new habit. And that's why I call this a start, stop, or continue moment. Because sometimes there are things in our routine that we know we'd like to stop.
No.
There are some things in our routine that we know we want to continue. And then there are other things in our routine that we say, okay, that's not a part of my life right now. I want to start that. And so it's a start, stop, or continue moment. And as you recognize these different habits in your life, I would ask, is that a habit you want to stop? Is that a habit you want to continue? Or is there something new you'd like to introduce and that you'd like to start? Because we are what we repeatedly do. Excellence is not just one act, it's a habit. So I will leave you with that as we transition over to Ms. Ruth Werner. Ruth's going to be sharing her screen. We're going to be talking about pathology today. Pathology, I believe I've showed you the book. Yes, pathology of the cardiovascular system and of the skeletal system. You now have met Ruth Werner, and I'm going to hand the reins over to Ruth. Welcome, my dear.
Thank you. Thank you, Jody, and thank you for those comments. That will never stop being true.
Mhm.
Uh, and one of the most wonderful things about this profession is that you will never, ever get to the point where you can say, oh, I don't need to learn anymore about this work. What keeps people alive and enthusiastic and gives people longevity in this profession is always to be learning something new. So I encourage you to build that into your habit forming. Excuse me. My cough is really going this morning. There's a weed here called Scotch broom
Mm.
that is blooming, and it's highly allergenic. And I was in a place yesterday where there was a lot of it. Um, so to give you a little bit of before I start sharing my screen, I just want to let you know what Jody and I have cooked up for you. Um, I have in my past written questions submitted, we call them items, written items for the NCB exam, the NCB certification exam, but also for MBLEx. And I have been on committees to sort of rate questions for how difficult they are or how, to review them for accuracy or whatever. This is by way of saying I know my way around a multiple choice question. Um, and you should too. Yeah, it is one of those skills that you don't need very often, but when you need it, you really, really need it. And so rather than give you a lecture on the cardiovascular system today, what I have done is compiled just a mountain of multiple choice questions to work through with you. And in the process, I encourage you to think about what kind of question you would write. I think it's a really good exercise. And when I am a teacher, and there's a couple of places where I occasionally am part of a core curriculum school, um, I encourage people, I will sometimes make an assignment to write a multiple choice question about this topic. So that you become familiar with, okay, this part is the stem. This is the thing that should get you thinking and predicting the answer. A good multiple choice question stem will allow you to finish the sentence or fill in the blank or answer that question before you even look at the choices. And then in the MBLEx now, typically there are three or four options. One of them is the answer, and the others we call distractors. Um, and you need to be able to recognize, of course, the difference between these things. And in a good multiple choice question, it's not obvious, which is why it's great to get your wheels rolling before you even look at your options so that you can predict an answer. If you have an answer in your head before you check, it is more likely to be correct than if you go open-minded to look at all of those options uh, and can easily get confused about those things. So let me go ahead and share my screen, and then I will ask for input from uh, your team here about whether I'm doing this correctly.
I got your
Because,
back.
thank you, because what I want is for that to be full screen, and I want for you to see the full screen, and I have my little tabs along the bottom. Is that
Beautiful.
correct?
Yes.
Okay, awesome. It's Skulls Day. MBLEx prep with me. I am board certified in therapeutic massage and bodywork, but I am retired from bodywork. I'm not retired, but I am no longer a bodywork practitioner, which is why I have to put that after my credential. So, chapter 5 is the cardiovascular system, and I don't know if we have any teachers here. PowerPoint has these little animations. So our thing today is decorated with little animations,
Fun.
which are really fun. But that's also why this file was so big, Jody, that when I sent it to you, it had to go through Google Docs because they are chunky. All right, but I mean, if we just take a quick look at this, this is just to refamiliarize yourself with this organ because this is anatomically not bad. We have these, make sure my cursor is correct. We have these two chambers on the top. Of course, these are the atria. The singular atrium means entryway. And then these two larger chambers.
I can do it.
Okay. We have these two larger chambers on the bottom. These are the ventricles. That word means belly, like ventrum. Um, and what is less anatomically correct about this heart is the way it's beating, because the way your heart beats is the two atria contract together and then the two ventricles contract together while the atria relax. So it's a two-part process where the atria contract while the ventricles relax, and then the ventricles contract while the atria relax. Lubbed up, lubbed up. And the noise that we hear is from these valves that are shutting in between the beats.
Hmm.
Anyway, there's a tiny little bit of review about your heart because it's really pretty amazing. Um, all right, so let's think about this. If you can recall what you have learned about the cardiovascular system, before you even look at the possible answers here, think about the answer to this question. Which of these chambers is responsible for pushing oxygenated blood to all parts of the body except the lungs? One of these chambers has the job of pushing blood from the heart all the way to your belly button, all the way to your earlobe, all the way to your great toe, virtually anywhere except for your lungs. And then it's the hydrostatic pressure and other venous contractions brings it back. So if you want to just throw in the chat which of these you think is correct, the left ventricle, the right atrium, the left atrium, or the right ventricle, which one pushes blood all the way to the body except for the lungs? Someone said, throw it in the chat. I'm not seeing anybody in the chat. Oh, we have shy people. Be brave. In the chat, what is the outdoor of the heart? The right ventricle, the right atrium. The right atrium. From the heart to the whole rest of the body and back to the heart again. left ventricle. So we have a nice range of options here. We'll go ahead and stop this. John Robert, you're on it. It is the left ventricle. And in fact, maybe I'll go back to this picture. Oh, that's not as useful as it might be. The left ventricle is the belly part of the heart that pushes blood into the aorta, which then goes up the carotid artery to the head and in an arch all the way to the rest of the body. It is the left ventricle that is responsible for pushing blood to all parts of the body except the lungs. It's the right ventricle that pushes blood out to the lungs. So remember, the atrium is the entryway, the ventricles are the exit routes, left ventricle to the body, right ventricle to the lungs. Okay, let's move on. That's good. You guys took a risk. Good for you. All right. The reason I wanted this slideshow is kind of heavy on things around blood clots because first of all, the questions show up on MBLEx, but secondly, these are the things that can really affect your safety and effectiveness as massage therapists. So what is the trigger for the formation of a blood clot? So think about your blood's going through your 60,000 miles of vessels. It's swooshing right along. Everything is fine. And then all of a sudden, for some reason, it gets thick and stuck in a place. Why? Why does that happen? Here are your choices. There's a rough spot in the endothelium where there's an area where the blood does not flow quickly, so it kind of pools. Or any area with external bleeding, or any area with internal bleeding, or an event that causes endothelial cells to release pro-inflammatory chemicals. Which is the best answer for this question? What is the trigger for the formation of a blood clot? What gets the whole thing started? What makes the blood form a clot?
If you prefer, you can do A, B, C, or D, but you can just type
Yes.
in what you think a portion
Oh
of that
yeah, these
answer
aren't
is.
ABC. Oh my gosh, why did these not come out as ABCs? That's so weird. I'm sorry. Oh, my friends, you are very shy today.
And we got a couple
Okay,
coming
we got
in.
A, the first one, Sarah, an iPhone. Morning, iPhone. All right, well, I'm going to reward our bold people, Zinab. Great, good morning. And say yes, it is A. So you have, oh, here they come. Yay! Um, you have in your blood a specialized, well, we call it a blood cell. It's not really a cell, it's a fragment of a cell called a platelet or a thrombocyte. Those words mean the same thing, platelet or thrombocyte. Thrombo means clot. When thrombocytes are circulating in your body, they're smooth. They look like little fish. But when they find any rough spot, any disruption on the inside of a blood vessel, the thrombocyte does this. You ready? It gets spiky. It's like the puffer fish from Finding Nemo, right? I'm sorry, making that noise always makes me cough. It gets spiky. It clings to the spot and it starts spitting out chemicals that weave a web to trap all of the passing blood cells. And that's a clot. And it's the same process, whether that's happening inside an artery or on your knuckle when you hit it on the grater in the kitchen. Okay. The process is the same. It's those platelets or thrombocytes that are activated by a disruption or rough spot on the inside of a blood vessel. That is the trigger that starts it all happening. Now, the other trigger here, you'll see there's this other phrase, an area where blood does not flow quickly. If blood gets trapped in an area and it doesn't keep moving, it will thicken. and form blood clots. That is a danger if the heart doesn't beat strongly enough. There's a condition called atrial fibrillation, where when a heartbeat should be nice and strong and look like this with atria beating in a strong and coordinated way, but sometimes something can go wrong and the atria flutter. So instead of lubbed up, it's flup, flup, right? So the blood can pool in here and not move out, and that forms clots, and those get pushed out into the body, and that is very bad news. So blood needs to go through smooth vessels and always be moving, or else we have a problem. Good job. And please be sure and speak up. If you have a question, put it into the chat because I don't want to go through this without answering your questions. Okay. He actually does move. There he goes. All right, let's move on and talk about thrombus and embolism. First of all, I want to look at this word thrombus. I hope that you have encountered words like this before. Thrombo means clot. So a thrombus is a clot. And typically we use this word to mean a clot that is not moving. It's caught somewhere. Embolism means clot that has moved or traveled. So what can happen with a thrombus? I'll give an example. My mother had it, broke her, she had a little fracture in her tibia and then was immobilized and didn't get it looked at. And by the time I got to her, she had a clot, a thrombus, all the way up her leg. Okay. And I was with her during the ultrasound. We saw the whole thing. Later, that thrombus broke into pieces and traveled into her lungs. That's an embolism. She lived. She was okay. So yeah, it was touch and go for a little bit, but she got through it. So a thrombus, lodged clot, embolism, it traveled. Okay. So thrombus and embolism refers to this situation where there's a clot and something is probably not great is going to happen about it. And here's the question. What is a possible outcome of massage for a person who takes medicine to manage the risk of forming blood clots? So after my mother had this event with her thrombus and her embolism, she was put on medication, which in those days was Coumadin, an anticoagulant medication, an anti-clot forming medication. We still use Coumadin. There's another one now called Eliquis, which is a lot easier for bodies to use. But the side effects can be similar. So think about if your client is taking a medication to prevent the formation of blood clots, right? To make blood clots not happen very well, what are some side effects that we might predict about massage? And here are your choices. Nothing. This situation does not pose any specific threats for an adverse event. B, easy bruising with light pressure. C, massage therapy makes anticoagulant medication more effective. Or D, this kind of medication causes numbness. So massage therapy is systemically contraindicated. Let's see, I'm seeing some B's come in. Anyone else want to offer an opinion on this? Sarah says D. Carol says D. Yeah, it's a good guess, but it's not correct. What anticoagulants do, their main purpose is to prevent clots. And that means people are going to have very delicate and easy bruising, even in their capillaries. So someone on an anticoagulant is going to bruise really, really easily. And that's a question that we want to ask our clients when they come in for massage is with your anticoagulant medication, do you find that you bruise more easily? The other thing that anticoagulants are also called blood thinners. That's right. Although that's a broader term, but good enough for now. Um, yeah, blood thinners. So another thing that happens for people who are using anticoagulants is if they do happen to bleed, right? If they do happen to get cut while they're making dinner or get, a thorn while they're out working in the garden or whatever, is they will just keep bleeding. They bleed for a long time because their clotting factors are interfered with, right? We have a problem with making blood clots. That's great for their internal circulatory system, but for the external circulatory system, it just means they bleed a lot and they bruise. Okay. Any questions before we move on? Let's ask another question about thrombus and embolism. Carol asks, but is massage contraindicated? Not necessarily, Carol. I'm so glad you asked that question. Massage is not necessarily contraindicated, but what we do need to understand is these folks are going to bruise easily. And so that means deep massage, massage with pointy surfaces, elbows and fingertips and knuckles, probably not a great idea for your clients who bruise very, very easily. But truthfully, if this person can safely apply lotion, right? If they can put, hand lotion on, or if they can put a moisturizing lotion on their legs or whatever, that's a form of massage, isn't it? So what you may need to do is recalibrate the depth of your massage. Use broad, flat tools instead of sharp, pointy ones. And that is going to be a much safer kind of massage for this client to receive. I'm so glad you asked that. Any other questions on this before we move to the next multiple choice dissection? Okay, keep them coming. All right, so in this question, the stem is, what is the best description of thrombophlebitis? Okay, from the word thrombophlebitis, if you know that the word root phleb, P-H-L-E-B, means vein, that's the only missing piece here. Thrombophlebitis, thromboclot, phleb vein, itis inflammation, an inflamed vein because of a blood clot. Okay? So what is the best description of thrombophlebitis? Veins closest to the bone are obstructed and possibly inflamed because of blood clots. Or veins closest to the skin are obstructed and possibly inflamed because of blood clots. Or blood clots have formed on the venous side of the systemic circuit. Or blood clots have formed on the arterial side of the venous circuit, of the systemic circuit. The systemic circuit means from the heart to the body, back to the heart again. So the outgoing blood is on the arterial side, the returning blue blood is on the venous side, and so that's what that means. So we have a B. We have two B's. Excellent. Veins closest to the skin are obstructed and possibly inflamed because of blood clots. That is the correct answer. And the reason we're looking for the veins closest to the skin is that the corollary to this, to thrombophlebitis, is another condition called deep vein thrombosis. Deep vein thrombosis and thrombophlebitis describe a similar thing, but the deep vein thrombosis, DVT, refers to veins that are close to the bone. They're deep. And thrombophlebitis typically refers to veins that are superficial, like the ones we can see. The great saphenous and the lesser saphenous veins are the places where this happens most often. They're also the veins that are likely to get varicosities, right? Varicose veins on those superficial veins. Excellent. Good. DVT. Exactly, Shireen. You're on the right track here. Any questions on this before we move on? Let's do one more on thrombus and embolism. All right. We're going to do, this is a hard one because it refers to some things in medical history. But I want you to give this a try. Okay. What are the three main factors in the formation of blood clots? So, given what we've talked about so far, if you ask this question in your head without looking at the possible answers, and you had to say, what are some things that are going to combine to make blood clots happen? Well, we already talked about disruption on the inside of the endothelium, right? And we talked about circulation where the blood doesn't move freely, right? Because it's caught somewhere and it thickens. So that leaves a third one. Let's see if we can figure that out from these choices. Okay. Venous backflow, valve degeneration, being sedentary. That's an option. Option 2, genetic predisposition, hemochromatosis. That's a disease where people have too much iron in their blood, and excess clotting factors. 3, endothelial injury, hypercoagulability. Hypercoagulability means too much clot making. Venous stasis, which means the blood is static. Or 4, excessive thrombocytes, too many thrombocytes, high clotting factors, and liver congestion. Answer is, I see a C. C. Yeah, I really laid this up for you. So I did. Good. I'm glad you're choosing these. This is a hard question. What this refers to, and if you've read about this, it'll be a familiar name to you. This refers to what's called Virchow's triad. Rudolf Virchow was a doctor in the early 1800s, who was the first one to write down, here are the three main things I see contributing to blood clots. And it is still the reference point today. He really nailed it. He had it just right. So these three factors are injury to the endothelium, hypercoagulability, people just making clots too easily, and venous stasis, the blood not moving freely. Great, you guys. This is pretty good. I see Jody going, Proud of your group. Good. Okay. Here's a Feed Me Seymour.
Lovely.
Love these. I think they're so fun. Okay. Now we have a question about DVT and thrombophlebitis. DVT, right? Deep vein thrombosis. And thrombophlebitis, which is the inflammation of a vein because of a clot. And what we have learned is that DVT refers to things that are deep. Thrombophlebitis tends to refer to problems that are happening more superficially. You have a new client. They had a DVT last year. Now he's completely recovered. He went on a hike yesterday and he wants to receive massage for his aching, tired legs. What is your best option? All right, so don't close your eyes. Don't look at the answers. And think about this. Thank you, Jody. So you have a client. We don't have any information here on how old he is or how fit he is or why he had a DVT. You have to make this decision without that background. Okay. He had a DVT last year. It was treated. He's fully recovered. He went on a hike yesterday. And he wants to receive massage today because his legs, the plural is important, are tired and achy. Do you think that's a good idea? Well, here are your options. Massage him deeply on his legs. He will benefit from the improvement in circulation. 2, determine what his normal activity levels are, then work within his capacity for adaptation. 3, apply lotion to his legs, but don't do more intrusive work there. When massaging his hands and feet, give special attention to the reflexive areas that correspond to his legs. And 4, work with his legs through the sheet to avoid providing excess pressure. Work with him normally elsewhere. There's a really clear best answer here. I see a B.
Go for it, guys.
The more you interact, the more you'll get out of this. So I want to really encourage you to type in an answer. And if it's wrong, that's cool because then we can take apart what we can learn from that. I'm seeing lots of B's. Awesome. Thanks, you guys, for participating. And that is correct. That is correct. Because both legs have the same problem. Right. If he had pain in only one leg, especially if it was the leg where he had the DVT a year ago, that would be a great big caution. Okay. Unilateral leg pain. Leg pain on only one side is a red flag because of the risk of DVT. Doesn't mean you can't work, but it means you need a lot more information before you can proceed. But as Sharon points out, because both legs have the same problem, because he went hiking, this is, all we need to do is make sure that we are staying within his capacity for adaptation. Now, that's a term that I made up myself, and I worry sometimes that not everybody interprets it the same way I do. But capacity for adaptation means, when we do massage, we challenge homeostasis, right? We are altering where blood flow goes and maybe body temperature and heart rate and all kinds of things. We don't want to do that for people who have a hard time maintaining homeostasis. So we need to always be sure that whatever massage we give stays within that person's capacity for adaptation. So if someone is quite frail, we're going to give them a gentle massage. If someone is healthy and athletic and muscular, we can give them a more rigorous massage. That's all that means, capacity for adaptation. Good. And I saw lots of B's come in while I was making that little clarification. And let's continue. Good job, you guys. Ha! Check this out. So, Shireen, this is going to be relevant for you and your very good observation. You notice mid-session, so you're in the middle of your session, that your 52-year-old client's calves are palpably different. On their left side, it's warm and pliable, and the right side, it's hot and swollen. And it leaves a dimple. Oh, this comes up with something you and I were talking about, Jody. It leaves a dimple when you press it, and maybe it takes 10 or 15 seconds for that dimple to refill. When you ask her about this, she says, "Oh, yeah, I forgot about that. My calf has been really achy. Can you give me a little extra time there?" What is your best option? All right, so think about this. Your client's on your table, you're halfway through the massage, you realize that her calves feel really different, and one of them is hot and swollen, and she's asking for deeper pressure there because it's achy. So what do? We do as she asks and give extra deep attention to the affected calf because the client is the boss. Or we finish the massage as usual, do not spend extra time on her calf. Or terminate the massage and counsel her to go to a doctor or ER immediately. That seems extreme. Or do only light strokes for the rest of massage and suggest that she see a doctor before her next appointment with you. Which of these do you think is the best choice for your client with unilateral calf pain? Oh, I'm seeing a lot of D's.
Key part of this leaves a dimple.
Yeah. Sorry, you guys, it's C. It's C. This person is at risk for an embolism. All right. She has a clot in her leg, or she very likely, thank you, Rob. She very likely has a clot in her leg If that embolizes, that's going to end up in her lungs because of the construction of the cardiovascular system. That's the only place it can go, right? Which is as what I described with my mom, right? She had a blood clot in her leg, it fragmented and it went to her lungs. There is in the medical record instances where from massage, people had a clot in their leg and it went to their lungs. I have served as an expert witness in litigation cases where something like this happened. The best choice here, the best and safest choice. Aha, Shireen, Katya. The best and safest choice here is to terminate the massage and get this person to a medical professional quickly. Because given her symptoms, what they will probably do is an ultrasound of her leg to determine if there's a clot. And if there's not, that's awesome. Hooray. She doesn't have a blood clot. But if there is, you might have saved her life. Okay. Good. All right, you guys. So let's the moral of this story is unilateral calf pain is a red flag. And then as Jody pointed out, there's another hint in here, which is about the dimpling. What this case describes is pitting edema. Pitting edema. Now, in my book and in the way that I have been preparing these sessions with Jody, that's really a topic for a different chapter because that refers to lymphatic problems. That's chapter 6, not chapter 5. But we, in our preparations for today, Jody said, let's be sure and spend some time to talk about edema. Edema, as you probably, as I hope you remember, means holding on to excess fluid, right? Retaining fluid in some part of the body. Oh, Shireen, you have edema going on right now. I'm sorry. It can be inconvenient. It can be painful. And sometimes it is an indicator of a more serious kind of problem. Okay. What edema indicates is a problem with circulatory return. And that problem can be in the lymphatic system, or it can be in the cardiovascular system, or a combination of them. Today, our topic is cardiovascular system. And so we would see edema in that context. We might see edema, for instance, as a consequence of having a weak heart. Remember that left ventricle that has to push blood all the way to the extremities in the body and then provide enough hydrostatic pressure for it to come back up to the heart. If the heart is beating more weakly, then we might end up not being able to push that all the way through. And so we can accumulate fluid in our extremities or whatever part of the body is closest to the ground. So for people who are walking, what that will look like, and I'm describing heart failure, what that would look like is great big legs, right? Lots and lots and lots of edema in the legs. For someone who's bedridden, who can't walk, what that would look like is edema in the belly, because it's just going to accumulate wherever gravity takes it. And that indicates that the heart's not working well. It could indicate that the kidneys are having a problem, and that creates a backlog through the system. Liver issues can sometimes do this, especially in the belly. And of course, lymphatic disruption if there's a problem in the lymph nodes somewhere. So these are the things that contribute to edema. The only kind of edema that is a great match for massage, unless you have some really special training, the main kind of edema that is a good match for massage has to do with a musculoskeletal injury, right? So if you have a swelling in your ankle because you had a sprained ankle, careful massage in that area can help resolve that, right? If your knee is swollen because you sprained your knee or you twisted your knee, massage might be able to help with that. But if you have edema because your heart isn't pumping hard enough or because your kidneys aren't filtering well, that is not a great match for massage without a lot more information and advanced education. The exception to this rule is if you have advanced education in some sort of lymphatic technique. So it could be lymph drainage technique or manual lymphatic drainage, There are variety, there's more than one way to do this, but it takes advanced education to do it safely. Jody, did you want to add to that?
I wanted to ask you to speak to women who are pregnant, because we see women, we see ankles, we see, some foot swelling. Um, and, in school we learn, that's lovely, to work with a woman who's pregnant.
With caution. So I have a few things to say about this. I should have had a, I don't think there's a pregnant critter to put in these. Um, there's a few things to say about this. One is pregnant people have, depending on how pregnant they are, have about 40% more blood than anybody else. And that includes clotting factors. The risk for blood clotting among pregnant people is much higher than it is for the rest of the population. And that's because of changes in chemistry. It's because of stress. When we are stressed, we create more clotting factors because in our hunter-gatherer mindset, we're going to be bleeding soon, right? Um, so it's a really good protective mechanism unless it goes on for a really long time. Okay. So we got more blood, we have more clotting factors, and I am not pregnant, but you could you could easily make a mistake. A pregnant person has a great big obstruction right at the place where the legs the veins of the legs converge into the pelvis. So we've got a mechanical obstruction there. So I'm sorry, something just shifted. Okay. Um, these three things, they combine to create a situation where someone who's pregnant has a much higher risk of edema, including pitting edema. Um, and I'm gonna go ahead and say that massage for the legs of a person who's in this state. I keep saying person, not woman, because I'm trying to get away from sex-based language. But for the person who's pregnant, I would like, and they have, a lot of swelling in their legs. Man, I would like for them to see someone who knows a lot about pregnancy massage, rather than someone who is just getting started. And I say that as someone who struggled with edema while I was pregnant, because I was traveling a lot, and then you have, airplanes and being sedentary and air pressure and all those things combining. Um, to me, this is a situation where I would want to I would want to refer someone to a massage therapist who has advanced education in pregnancy massage and pregnancy massage related risks.
Yes, very good. Thanks.
You
It's
bet.
just again, sometimes these clients, we don't know they're pregnant until they arrive, and
Oh
so
yeah, and in early stages of pregnancy, it's much less of an issue because we're not carrying all the extra blood and the extra pressure on the leg veins and all those, all those things. I mean, I was a teacher at a massage school in Seattle, and we were doing a unit on abdominal massage, and I got on the table and had like 20 people palpate my psoas, right? Deep, intrusive work right next to my uterus, and found out I was pregnant the next day. And she's
oh
34 now, so
my.
we're okay.
Okay. Good Lord. Whoops.
Yeah. I mean, human beings can put up with a lot of stuff. So
Amen. That's so true. Yes. Yes. Thank you for explaining edema, swelling,
yeah.
injury, inflammation.
Right. Okay. So we wanted to, I actually want to take a second, and make some clarifications about edema versus inflammation. Okay. So inflammation is a tissue response to an injury. Um, in a situation like a pregnant person whose legs swell up, there may not be an injury. That's a chemical mechanical issue. right? But when there's an injury and we have swelling as part of that inflammation, remember that in inflammation we have the four cardinal signs, which is heat, pain, swelling, and I am getting away from the word redness because it doesn't look red on everybody's skin. So I'm switching to discoloration or flushing, right? But the skin gets hot and infused and swollen, and it's painful. And these are the cardinal signs of inflammation. So we can have swelling without those other things. It doesn't necessarily have to be hot or painful. It can just be swollen. It can just be edematous, right? If you think about someone who has lymphedema, which is a whole different thing, but they've got, say they had lymph nodes in their arm removed and now they are retaining water in their arm because their drainage system has been disrupted. This is edema that is not necessarily infected. It's not necessarily reddened or discolored or flushed. It might be painful just because of all the excess pressure, and it is enlarged, right? Because of retaining excess fluid. So edema and edema and inflammation are connected, but they're not necessarily the same thing.
Thank you.
You're welcome.
As in the MBLEx, I want our massage school graduates to be careful if there is a description of that includes the word edema or pitting edema.
Yeah. Another red flag.
Yeah, exactly. And versus inflammation, which
I mean,
source
two
is
different
mostly,
things.
yeah.
They're connected, but they are not the same. Good. Atherosclerosis.
God bless you.
So, we are switching. We're getting away from the whole blood clot thing now, and we are moving over to the arterial side of the systemic circuit. So remember, the systemic circuit is heart to body and back to heart again. We've been talking about the return side. Now we're going to talk about the outgoing side, the arterial side of the systemic circuit from the heart to the body. And atherosclerosis is the condition where the blood vessels close to the heart, including the coronary arteries that actually supply the heart muscle, and the carotid arteries and maybe the aorta, get damaged from chronic high pressure, and they accumulate these deposits of fatty plaque. And that's what atherosclerosis is, right? Fatty plaque on the insides of arteries where blood pressure is very high. So, which of the five just gave it away? But with that understanding, which of the following conditions is marked by the accumulation of fatty plaques? Boy, I really gave it away. Is marked by the accumulation of fatty plaques inside major arteries. Would that be aneurysm, arterial vasculitis, hypertension, or atherosclerosis? So John Roberts right on top of it. Anyone else? Yeah, we got lots of D's, which is good. As we should. That is atherosclerosis. And I will tell you that the links between hypertension and atherosclerosis are very, very, very strong. It's hard to have atherosclerosis without hypertension. That's high blood pressure that begins the process of damaging the inside lining. And between the two of them, that's responsible for about half of the deaths in the United States every year.
Wow.
Yeah. Yeah. I've just been updating this chapter in the book. So I'm on top of this stuff. Which of the following forms of atherosclerosis is most likely to lead to a transient ischemic attack or cerebrovascular accident? Cerebrovascular. What does cerebro make you think of? And maybe you're already familiar with TIA, transient ischemic attack. But the key word root here is cerebrovascular accident. Okay, so which of the following forms of atherosclerosis is most likely to lead to a TIA, a transient ischemic attack, or a cerebrovascular accident? Would that be atherosclerosis in the coronary artery disease, vascular artery disease, carotid artery disease, or peripheral artery disease? Do, 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 do.
Yeah, I was trying to play some Jeopardy music.
I'm seeing B.
Can you hear that at all?
Shireen got brave with a C. There's a D. Okay. So cerebro means brain, right? Like your cerebrum. So a cerebrovascular accident is a stroke. It's a fancy word for a stroke. And a TIA is a fancy way to talk about a mini stroke, right? If you've ever heard of those. A TIA is an obstruction gets in the brain and it's so tiny that it melts really fast. And so it doesn't lead to long-term problems. What is the artery that carries blood to the brain? Where is someone who has atherosclerosis? Yeah, there you go, Jody. The artery that carries blood to the brain is the carotid artery. So when we have atherosclerosis in the carotid artery, which is called carotid artery disease, this is what's going to raise the risk for something fragmenting and breaking loose and going into the brain, either as a TIA or as a cerebrovascular accident. So the correct answer here is C. And I got you, almost all of you. Shireen got it. Well done. Okay. No. Tell me more about the no.
Could you speak to like we talk about like eliminating a wrong answer.
Mhm.
And
Oh, yeah, that's
so
a good idea.
as you look, and as you look at these, are there maybe one or two that you could say, yeah, no, definitely not?
Sure.
Yeah, because we got a
Yeah, thanks.
TIA, we
That's a
got a,
really good idea. That's
yeah,
a really
because
good
there's
idea.
a couple in there that I'm like, eh.
Okay. So with these clues, transient ischemic attack or TIA and cerebral, I keep going using my cursor on the wrong screen. And cerebrovascular accident, which is a stroke. I mean, what we get out of that is brain. Okay. We are now looking for blood flow to the brain. The, the coronary artery is the artery that supplies the heart. So that's not it. If there's going to be an obstruction or atherosclerosis in the coronary artery, that's going to lead to destruction of parts of the heart. We call that a heart attack. Okay. Vascular artery disease is possible, but that's very vague because it just means artery disease in any vessel. It's a little bit redundant and it's a made up term. Carotid artery disease tells us the location is the carotid artery, which is the artery in the neck that carries blood to the head. Okay. And peripheral artery disease is a real thing. It is a type of atherosclerosis that occurs off the aorta. So it refer to something going into the kidneys, into the intestines, or even into the extremities, into the legs. Okay. Peripheral artery disease is pretty rare unless someone has advanced disease, other kinds of diseases like diabetes. Okay, so the best answer here, we can rule out coronary artery disease. We can rule out peripheral artery disease. So that leaves us with vascular or carotid. And because we know this is going to the brain, there's a best answer, which is carotid artery disease. Does that help, Jody? Is that what you were after?
Absolutely. Yep. As far as eliminating. And I'd also just mention that when someone takes their pulse,
Mm-hmm. Right here.
yeah, you're
It's at the
actually,
carotid artery.
it's the carotid artery. So,
Yeah. Pulses are amazing to me because they are essentially ripples of the heartbeat. Because you get the same, it just goes, if you think of ripples going all through your body, so you can get a pulse at your styloid, radial styloid, styloid process of the radius. It's been a while since I've taught bony anatomy. You get a pulse at your ankle and get a pulse at your neck. It's all the same ripples going out from the heart. It's kind of beautiful. All right.
It's pretty cool.
Okay, one more question on atherosclerosis, and I'm sorry, this is death by PowerPoint, but some of these questions, the situational ones, are a little bit long because they want you to think about decisions you would make in the clinic. The job of the MBLEx is not to see if you're a really, really great massage therapist. The job of the MBLEx is to see if you can be safe while also effective, which is to say, as I have said in this class before, the very, very safest massage you can ever give, where you guarantee never, ever causing any harm, is to not do massage, right? But that's not very effective. So the goal here is threading the needle, right? So we can do massage if it's appropriate and also be safe. Which is why, just cancel the massage is not always the right answer. Okay, so your client, just close your eyes, let me read this to you. Your client has been diagnosed with atherosclerosis and hypertension. So he's got these fatty plaques and he has high blood pressure. He takes a statin. That's a drug to lower cholesterol. He takes beta blockers, which are drugs to reduce blood pressure, and a blood thinner. So he's also on an anticoagulant. He takes a statin, beta blockers, and a blood thinner. He is also in training for a triathlon next month. So he runs 3 miles a day. He swims 5 times a week. He would like to add massage therapy to his routine. Can you work with him? So we have really alternating points of view here, right? Which is, this totally happens. This 100% happens. I had a client who had a mild heart attack at age 40, turned his life completely around, and at age 45 was healthier than he had ever been, right? Because he started doing things really differently. Okay, so he has atherosclerosis and hypertension. Let's say, because it's not listed here, he's never had surgery. He hasn't had to do an angioplasty or anything like that. He's never had a heart attack, but he's been diagnosed with these things. He takes a statin, a beta blocker, and a blood thinner. And he's in training for a triathlon. He runs, he swims, he wants to include massage. Can you work with him? Here are your possible answers. Nope. This person's at risk for a myocardial infarction. Massage therapy will only increase that risk. Nope. This person needs to wait until his treatment for atherosclerosis has been completed before he pursues massage therapy. Yes. Gentle massage will help drop this person's blood pressure and allow him to reduce his medication. Or yes, this person's condition is under control and he is physically capable of keeping up with the adaptive stressors of massage therapy. This is really fun.
Yeah, right?
This is really fun. Okay, and I love that not everybody agrees with everybody.
Exactly.
Yeah. So for Rob and Sarah, what I want to tell you is that his treatment for atherosclerosis will never be completed. It will never be. He will be on these drugs very likely for the rest of his life. Okay? So that's not a realistic answer. But if you think about what kind of stress you create, what kind of homeostatic challenge you create with your massage, is that greater than running 3 miles? Is that greater than going, swimming for a mile? Right? And I guarantee you, even with the most rigorous sports massage, you are not stressing that body more than a 3-mile run. So there you go, Shireen. If he can run, he should be able to handle massage. Absolutely, 100%. That is correct. And in general, I will say that if you have a client, this is true for your MBLEx, but also this is more importantly true for real life. if you have a client who has a complex medical history and they are, they have had a heart attack or they have had MS or they have had, some serious, maybe even life-threatening condition, and their doctor wants them to exercise and exercise rigorously, I should say, get their heart rate up for 20 minutes 5 times a week. If they have that kind of encouragement from their doctor to exercise, they are probably a good candidate for massage, for most kinds of massage. Sarah asks, could he handle deep tissue too? I better have this same brain the day of my MBLEx. Yeah, Shireen, you've been doing well. Can he handle deep tissue too? Deep tissue is a term that I hate because it doesn't mean the same thing to all of the people who use it. With this client, I would not feel badly about working as deeply on his, particularly on his extremities, as he wants. I might not feel awesome about working deeply in his abdomen where I could come close to his aorta, but I also am not an expert on body work in that part of the body. So the word deep tissue is a little bit iffy to me. The cool thing about backs, though, the cool thing about the construction of backs, which is where everybody wants massage, is, think about an anatomical drawing of the back of a person, right? The back of their head, the back of their neck, the back of their back, and all the way down into their bottom and into their legs. Until you get down past the buttocks, no major blood vessels here. No big blood vessels to interfere with over the back, which means deep tissue, whatever that means for you, over his paraspinals, working with his latissimus, working with his trapezius. That's all not going to have a huge mechanical impact on his cardiovascular function. So could he handle deep tissue? Probably, depending on what you mean by that term. I would say he could probably handle whatever depth is comfortable for him. And this is going to be a really fun client to work with because they've been through a health scare and they are now taking excellent care of their body. And they are, going to be really, really invested, as you will if you have already started working with people, through school or working with your friends and loved ones. There's just a huge difference between working with someone who really knows their body and someone who's just learning about their body. Both of them are fun and exciting. My favorite client ever was the chiropractor that I rented space from because she was also a ballroom dancer. And, she knew her body so well and she could do anything. It was incredible. All right. Thanks for attending, Rob. Great to have you here. And we have 10 minutes left, Jody. So
yes, and so
right?
just to be clear, D number 4 was the best answer.
Yes, number 4 was the best answer. I have given Jody the entirety of this slide show and also a whole long list of other questions that you can have fun with. And so you can get those from Jody. I want to pop ahead and take a look at some skeletal issues, specifically around osteoporosis. Okay. If you own bones, you need to know about osteoporosis. And if you are in your 20s and 30s, this may seem like something that will never really be a problem for you. I guarantee you that is not the case. If you live long enough, you're going to have to deal with osteoporosis, particularly if you are female. So here's a question on osteoporosis, bone thinning. Okay. You're working at a chair massage event. Your first time client is a frail looking 83-year-old lady. She's about 5'2". She tells you, she used to be 5'6". What kinds of accommodations, what did I do with this slide? What kinds of accommodations might she need? She might need to have firm massage that addresses muscular spasms that go with her stooped posture. She might need to have a doctor's permission before she can safely receive massage. She might need gentle massage at first, but firmer pressure then to unlock the muscle patterns that cause her pain. Or she might need to have gentle massage that does not put her at risk for fractures of the spine or ribs. I'm seeing a lot of D's. Well, I'm seeing two D's. Really? Yeah, you're right. Well, yeah, you're right. I mean, you have some clues here. She's frail, she's 83, and she has lost height, which suggests that she's already had some vertebral body thinning or maybe even fracturing that reduces a person's height. Um, the one of the most common adverse events that I read about is accidental fractures of spine and ribs. And so let's not do that. If she comes to see you for table massage and you can bolster her so that she is comfortable on a table, conceivably you could work very gently on the front side of her spine to help unlock some of the hunching back movement patterns, but in a chair massage in that kind of setting, let's just stay really, really gentle. Good. Oh, that's a stupid one. Let's go to this one. What is an accommodation that a client with advanced osteoporosis might need? I think I just gave it to you. Help getting off the table because of dizziness. Extra deep pressure on the paraspinals to undo chronic muscle spasm. What could possibly go wrong? Imaginative bolstering on the table. Clients with osteoporosis should not receive massage. There's a really, really obvious right answer. Osteoporosis doesn't particularly make you dizzy. And there's no reason they can't receive massage, but it has to be very, very careful massage. It is C. It is C. If you've ever had someone in your life with osteoporosis, they're hunched, they don't have a lot of flexibility. This person might need an extra pillow under their back. They might need something under their knees. They might not be able to lay down flat, and so they need to be on their side. Whatever makes them comfortable is what you need to provide for them. And I'll tell you, I mean, I know you guys have not started your careers yet. There is a big career to be made in working with elderly clients. Um, Elderly people have more disposable income very often than younger people. They have a lot of pain. They would like to not have to manage it with pain medication all the time. And so, if this is something that appeals to you even a little bit, think about work you could do with people who are older. Um, and that means you're going to be working around and with people who have osteoporosis. Let's talk about osteoarthritis. OA, osteoarthritis. Does osteoarthritis usually contraindicate massage? Think about your answer. So, osteoarthritis, inflammation of joints, specifically inflammation of synovial joints. This is what we see at knees and hips and shoulders that require joint replacements. But people can develop osteoarthritis in their fingers, in their toes, and lots of other kinds of places. Osteoarthritis, does it usually contraindicate massage? Massage therapists get it here in the saddle joint if we're not very careful about how we use our hands. Does it contraindicate massage? Nope. Massage therapy can improve nutrient uptake to help rebuild cartilage inside joint capsules. No, it doesn't contraindicate massage. It's seldom acutely inflamed, and massage can often help to mitigate pain. Yes, it contraindicates massage because it involves acute inflammation, which can be exacerbated by massage. Yes, it contraindicates massage because we can irreparably damage already weakened joint tissues. So what do you think? A, B, C, or D?
These are great answers. Just tricky enough.
Yeah, just tricky enough. Okay. So I saw an A. And I'm sorry, I wish it were true that massage could help us rebuild cartilage. Um, it doesn't. um, and I'm not seeing C's and D's, which is great. So the correct answer is B, which is osteoarthritis is seldom acutely inflamed. I mean, if someone has hip pain, right, from where that's worse with when the weather turns, when you touch their hip, it's not going to be hot and inflamed and discolored. It's just going to be deeply achy because that's how osteoarthritis works. We don't see acute inflammation with this. We see deep, achy pain. And that's going to reflect in muscle tension and holding around those joints, which massage therapy can help with. We're not going to fix it or cure it or reverse it, but we can help deal with the pain. Good. Nice work. All right, let me see if I've got more bony ones. I have some joint things. Plantar fasciitis, carpal tunnel. All right, Jody, you tell me what you'd like. I've got joint replacement surgery. Um,
Yes, let's do that.
okay, JRS, joint replacement surgery. So your client has a new joint. Here we go. What is the most likely adverse event regarding massage therapy for a person who has had a joint replacement surgery? So think about the most common ones are knees and hips, right? So someone has a new hip. What's the worst thing that is likely to happen if someone does massage and they're not well informed about this? Osteoarthritis is a factor in most joint replacement surgeries. This condition can be spread with rigorous circulatory massage. So you might spread arthritis. 2, overambitious stretching or joint manipulation can loosen a prosthetic joint. 3, post-surgical infection could happen even after the scar has fully closed. Or 4, on the opposite side, massage therapists must be careful not to exacerbate contralateral symptoms. So we don't want to work on the opposite side because we might make that worse. Or the most likely adverse event is that they have an infection even after the whole thing has closed up. Or we could stretch it too far and loosen the prosthetic joint. Or we could spread osteoarthritis through the rest of the body. Good. I'm glad to see you have not fallen for my bad answers. It is definitely B. And that's something we need to understand about people with any history of joint replacement, but especially around hips and shoulders. Their range of motion will never be what it was before their surgery. And so it is inappropriate to try to stretch them. And I have a client whose stories about people with a new hip who want their massage therapist to stretch them further than is really in their best interest. So that's something we have to be very conservative about and may need to consult with their healthcare team about. But it's definitely B. Overambitious stretching or joint manipulation can loosen a prosthetic joint, cause that new joint to fail, and then they have to go for a repeat surgery, and that would be bad. Okay. Should we do one more?
Yes, let's.
Okay. I've got sprain, TMJ problems, plantar fasciitis, carpal tunnel, disc, myofascial pain syndrome. You said skeletal, and I'm sorry, I took musculoskeletal, so I did mostly soft tissue injuries here.
There was one in there. Let's do carpal tunnel.
Okay. Carpal tunnel syndrome. Good. Carpal tunnel syndrome. So you will recall that carpal tunnel syndrome has to do with the carpal tunnel, which is a tunnel that is composed of the carpal bones, the wrist bones, and the bridge over the tunnel is the retinaculum ligament. So there's a structure in here that can get caught and make problems, and we call that carpal tunnel syndrome. Someone is raising a hand.
The computer thinks you are.
Oh, really? How funny. I had
Yeah.
never seen that feature before. And Shireen, yes, you're right. That is costly to have to go back for a repeat surgery. All right, massage therapy for a client with carpal tunnel syndrome is safe if the treatment can be done without exacerbating symptoms, if the treatment can be done without the use of analgesics, If the client has other issues that might contribute to his symptoms, if the client has carpal tunnel syndrome bilaterally, and it is possible for people to have it on both sides. It's not typical. It's usually because of pregnancy or hypothyroidism or some kind of general fluid retention. So what's the best scenario here for massage therapy for someone who has an entrapped median nerve in their hand? Can you work with them safely, and under what circumstances? If the treatment can be done without exacerbating symptoms, which of course means making those symptoms worse, right? Can you do the treatment without making their hand zap? Can you do the treatment without having your client need analgesics? Hopefully, we are not encouraging our clients to take pain medication before they come see us. Okay. So John Robert, good, excellent. Client has other issues that might contribute to his symptoms. That's an okay answer, but that's not talking about carpal tunnel syndrome. Client has carpal tunnel syndrome bilaterally. That is not a safety issue. So the safety issue here is A, that treatment can be done without making things worse. So we actually have some nice data on massage therapy for people with carpal tunnel syndrome. People have researched this about working with the musculature in the hand, in the arm, to improve grip strength and reduce pain. But anything that's going to send a zap down into the hand is only going to make things worse. So we need to work in a way that does not exacerbate symptoms or make them worse. Okay. But how would you know if it would make it worse? Oh, your client will tell you. So, because it happens right there. This is a nerve entrapment. And if you've ever had something like a funny bone, right, when you accidentally zap your ulnar nerve and it goes zip, you will know exactly what that feels like. But in this case, it goes zap into the hand. Okay. So yeah, that's, if you want to call it a nice thing, it's sort of a nice thing about nerve situations is you get instant feedback. Good. Thanks. I'm glad you asked. Thanks for asking that. All right. Well, we sort of have come to the end of our time, and I have other meetings that I need to get ready for today. So we'll have a little dancing ogre here. He's really cute. I don't think I've used this one before.
That's so fun. Yes.
Yeah.
Well,
So thanks for being with us. Jody, you have some things you want to wrap up with?
yes, yeah, I'm gonna stay on after the recording, but I wanted to first say thank you so much, Ruth, for being here. That your point of view is just so clear and those questions, I love that they are so structured, just like the MBLEx questions, is that there's good distractors in your answers, and that our massage school grads really got a chance to sink their teeth into some wonderful cardiovascular conditions and also some skeletal conditions. So thank you so much for being willing to share your wisdom. Really appreciate it.
Oh, always my pleasure, Jody. I'm so glad to have this opportunity to work with you. Carol has asked, can we go back to the first question? I'd like to print. So I want to say that I have given the slideshow to Jody plus a document with all of the questions and lots more. So she can get that to you.
Yep, and I'll be posting that document with the recording of this video. So in the Patreon app, you'll be able to see that and download it and print it. So, yes.
Perfect. Easy.
Yes. But this will wrap up the recording and say again, thank you so much, Ruth. Appreciate it.
I'm really, really glad to be here always, Jody. And you guys, good luck on your future endeavors. And maybe I'll see you the next time.